Hello, everybody, and welcome to my short information webinar here called Manual Therapy and Chronic Illness. My name is Purves. I am a registered massage therapist who lives on the west coast of Canada, and I've done my Master's of Science degree at the University of British Columbia in the impacts of massage therapy and how do we use manual therapy to provide pain relief and also optimizing wellness for chronic pain and other chronic health conditions. And I'm honored to be here for you. So I hope that in this webinar, you will find some information that's useful to you so you can make better decisions about finding and utilizing manual therapy and massage therapy as an approach to help you with your self-management. Now, what's really interesting is that our entire human body is made up of a system that is responsible for giving you information about noxious stimuli. And this is called the nociceptive system. And what do we mean by noxious stimuli? Well, what I mean by that is it's the stuff that doesn't feel good. Right? If you poke or prod or cut yourself and you feel pain, it's usually because your nociceptive system has been turned on. Now, the receptors for the system are located in pretty much all regions of your body, including all of your internal organs. Now, this picture that you can see here, this shows the skin, and this shows that these nerve endings are coming up here into the upper layers of the skin. And when we poke at ourselves or we get cut or a bruise, it's usually because, and it hurts, it's usually because these sensory neurons are being activated. Now, when we're looking at the role of this system in our internal organs, well, the same thing can happen is when an internal organ is inflamed, it's damaged, it's irritated, or it's distended because there's some type of swelling in there. This can result in activation of your nociceptive system as well. And we see things like people with kidney problems and kidney disease will oftentimes experience pain kind of in the low back or the abdomen, or it may radiate out there a little bit because this system is being turned on, it's being activated because something in that organ or in that system is not feeling great. And this is normal, and this is important because this lets us know when things aren't doing well. So we need this system for us to really survive and thrive. And so when we're looking at what does manual therapy do, why are we doing this talk here on manual therapy? What's the point? Well, the thing is, what's really great about manual therapy is it's actually a very powerful modulator of the nociceptive system. So your system that is responsible for us for experiencing pain, we can use touch to either turn that volume up or turn it down. Now, obviously, our goal as a manual therapist should be to turn the volume down, to make that area hurt a little bit less. That's what we're striving to do. But that's the thing. So one of the things that's so magical about the power of touch is that we can put our hands in different areas. We can put it broad. We can be pokey. We can move quick. We can move slow. We can provide a different physical property of that touch. And through our touch, we can actually infer different emotional properties like kindness or affectivity. So people, when we're putting our hands on, they can tell what we are feeling, and we can usually tell what they're feeling because there's a lot of communication that occurs through the power of touch. And when we look at what's on this slide here, there's kind of three main things that I want you to appreciate about what touch can do for you. Now, number one is analgesic modulation. So this means when you put your hands on somebody, we can hopefully change how that nociceptive system is feeling. So if you're feeling a lot of pain and someone goes and puts their hands on you and gives you a nice massage, hopefully that'll turn the volume down and will temporarily decrease the level of pain that you are experiencing. We can also have what is called affective responses. So these are these emotional responses. And what we know through a lot of bodies of research on the impacts of touch and massage is that massage is really, really good at lowering stress. Massage can lower levels of depression. can lower levels of anxiety, can lower levels of stress, and can also help with good quality sleep. So if you're feeling stressful and anxious and you're not sleeping well, massage or any type of manual therapy can be a very useful tool for you to seek out to help with kind of managing those symptoms. Now, it's not going to last forever, but if you're living with a chronic illness, sometimes even these temporary reductions in your symptoms can be quite impactful and quite powerful. We also have what's called this big word down here. It's called somatoperceptual reorganization. What does this mean and why is this important? Well, if we have a chronic pain or chronic illness, chronic disease in an area, and that area, what tends to happen is we tend to dissociate from the area. Like we tend to pay less attention to it in a way that's positive. We usually give negative attention to that area. So if you're experiencing, say, low back pain, your perception of what's going on or what's happening in your low back can be different. And so we can use touch to kind of bring an awareness to that area. And what the researchers use here is to discriminate between safe and threatening stimuli. So if your low back, for example, is often a source of discomfort and pain, we can use touch to help bring some positive feelings and some positive awareness to that area to hopefully make it feel better. And these are all really encouraging and really positive things, because touch, not only does it feel good, but it can help with your anxiety, your depression, your stress, help you sleep better, and can also bring more positive awareness to an area that might have a negative, you might have a negative relationship or negative connotation to. And the reason I bring this up is because so often manual therapy and massage therapy is focused on dysfunction, looking to fix something. But what I want you guys to start thinking of is if you decide that this is something you want to use for your for part of your management plan, is I want you to start thinking about seeking the care of somebody to reduce your sensitivity and to increase your feeling of wellness. Because we know in chronic illnesses that we can't change things, we can't fix things, particularly through touch, but we can hopefully decrease how your body is experiencing that illness and hopefully make it feel better by turning down the volume on the level of sensitivity that you might be feeling in that area on that day. So the question that we often ask is, well, which technique should I use? Which approach works best? And what I would say is that it doesn't really matter what you do, whether you want massage therapy or chiropractic or acupuncture or physical therapy, or you want to go to a spa. It doesn't really matter what works best. It's what works best for you. There's not a right or wrong approach. It's an approach that fits your needs best. Because what matters is the context of the treatment matters more than the actual specificity of the intervention. And this is well established in the manual therapy and pain literature. And there's a great quote here by a researcher named Norton Hadler, where he says, "The treatment act matters more than the specificity of the intervention." And the term they use for this is called contextual analgesia. And what this means is that when you go and seek the care from somebody, and if you have a good relationship with them, you like them and they like you, and they provide a treatment that meets your needs, that feels good for you on that day, you're probably going to have a better response, more pain relief. You're probably going to feel more optimistic and happier about the treatment than if you didn't receive a treatment that you liked. So going to seek the care from somebody matters more than the specificity of who you see. And sometimes there could be a little bit of trial and error here, where maybe you're trying some different therapists, or you're trying a different type of therapy. But finding one that works best for you, or finding a couple that works best for you, is the most important thing. There is no right or wrong. And one thing that I always like to say is that when you go to seek care from somebody, when you want to go and get a massage, for example, right? The person should be focusing on treating your overall system, not just one area per se, because when you get treated with and you live with some type of chronic illness, it's more about focusing on treating the person as a system or the person as an ecosystem. So the goal should be to make the area feel good. Your positioning when you're on the table should be one that makes you feel comfortable. Lying on your back, your side, your front, maybe even sitting up a little bit. That's what matters most. These are things that you should advocate for. If the person's moving you, if you like something, ask them. Say, hey, push, pull, twist the skin, do things this way, do things that way. Can you please do more of this or less of that? You are in control, right? And the thing is too is that you want somebody that takes the time to be with you, that they hang out, they're going to be kind, they're going to spend time with you in a way that feels good, and they're not going to rush you through a treatment, or they're not going to rush through an area. And when I say this last one says contract, relax, is what I mean is that it's good to incorporate some movement. So ask your therapist, say, hey, can you incorporate a little bit of movement in here? Maybe just whether it's moving my limbs around, or maybe you can show me some exercises to do after, or maybe you can do them during or before. These are all really, really, really important things for you to advocate for as someone who lives with a chronic illness, to focus on when you're getting treated. And this is a paper that I co-authored a couple of years ago, and there's a lot of overlap between a person-centered approach to chronic pain and a person-centered approach to a chronic illness. And the couple points here I really want to bring to your attention are this: is number 2 is facilitate a trusting relationship. So what you should be doing is make sure that you have a trusting relationship with your clinician, right? Someone that responds to your values and your goals. Right. And the other one too is number 5, which is I think is so important, is promote the use of self-management strategies. So when you go to see a massage therapist or a manual therapist, ask them if you can be part of their if they can help you form a self-management plan. Because we know that these chronic illnesses aren't going to disappear, and you're going to have to learn to live with them and manage them. And that's okay, because most of these things can be managed quite well. But encourage the therapist to have a conversation with you about how can you incorporate movement and exercise or physical activities that are meaningful and enjoyable to you, because those are the ones that matter most. If you go to see somebody that just is trying to fix your problem, you know that's a red flag and you need to find somebody else. But find someone that works for you. Know that the trust that you have with them and the touch that they provide is extremely valuable and can help you hopefully live better and manage your symptoms better. Because we know that living well with chronic illness is possible. And using massage or manual therapies as part of your management plan is a useful option for you to help you to live better. Right? We know that massage can provide pain relief. We know that it can help with some aspects of mental health. We know that it can increase the quality of your sleep. We know that massage therapists and manual therapists are trained to provide you with movement, education, and lifestyle strategies to help you live better. So please, when you go to see those people, these clinicians, please ask for them to provide you with these things and advocate for yourself, so that you can get the care that you deserve, so that you can live as well as best as possible. There's lots of people out there, so don't feel that if you find someone that doesn't work for you, that you have to, that means they all can't. I highly encourage you to search and to try some different people out and try some different strategies, and knowing that manual therapy and massage therapy are very, very good options to help you to live well and to make your life a little more enjoyable. So thank you for paying attention. Hopefully you found this information helpful. If you need to reach out to me, you can reach me out to me on any of these platforms. I'm happy to provide you with information or to send you some resources if possible. So all the best to you, and thank you very much for being here today.